Good morning. My name is Dan Sterman, and I am a pulmonary and critical care physician at NYU Lang Health in New York City, and a member of the Foundation's Board of Directors at the Mesothelioma Applied Research Foundation. And actually, I have a long-standing history with the foundation dating back almost to its inception. So it's been an organization that I have incredible fondness for, and it's one of my favorite symposiums that I'll ever be at because of the connections between patients, families, physicians, and scientists that's so incredibly unique. I wanted to welcome you to this year's symposium. I believe it's the first symposium since the pandemic, and so it's extra special for all of us and for what we've all been through as a global community. To be able to be together, support each other, and learn together is incredibly impressive and exciting for me. So on behalf of the board, our scientific advisory board, our community advisory board, the staff, the volunteers, the people who run the summit, we're thrilled that they're helping make this event happen today, and welcome. We're glad that you're either here with us at home or virtually, and we really hope that you'll enjoy the entire experience today. It's also my pleasure and honor and privilege to turn over the mic to our new executive director, Julie Powers. Julie.
Thank you, Dr. Sterman. Okay, mask off and glasses on. Middle age is hard. Good morning and welcome everyone to the 2022 International Symposium on Malignant Mesothelioma. Again, my name is Julie Powers. I'm almost a year into being the executive director of this incredible organization and community, and I am so grateful for the opportunity to serve. You guys have probably seen emails about who I am and what I do, but I'm a dog parent and I dragon boat. There you go. That's all you need to know about me. I also bring you greetings on behalf of our board chair, Marjorie Zotterer. She's an oncologist at Memorial Sloan Kettering. Marjorie had hoped to be here in person today to welcome all of you. Unfortunately, she had a family emergency. She will be joining us virtually in the scientific meeting, and she is facilitating that meeting along with Dr. Pikert. I also want to say thank you to Dr. Hetty Kindler. Dr. Kindler, there you go. Dr. Hetty Kindler, as many of you know, is one of the foremost experts in mesothelioma. She's based here at the University of Chicago, and she has graciously agreed to serve as our faculty director, also known as wrangling the team at the foundation, to make sure that the sessions meet the needs of our patient community. I also want to say good morning, and I want to acknowledge many of our board members who traveled here today to be with us in person. Jessica Blackford-Cleaton, Cheryl Brunner, Keith Sengel, Dr. Keith Sengel, Darcy Cristal, Dr. Jason Foster, Berkeley Opalaki, Dr. Dan Sterman, who we just met, and Bill Ziegler. I also want to say hi to, or introduce our team. Most of you who've been with the foundation for any period of time are familiar with Maya Bellameric. Her title has operations and communications in it, but it's she who gets it done is her real job, and my right hand. Many of you have had the opportunity recently to meet our new patient services director, Shannon Sinclair. Shannon, you want to wave? And at the front desk, checking in, you probably met Megan Butler. She's in the back of the room. If you have any questions or concerns about the facility, you talk to Megan. She'll take care of you. And her sidekick is our intern, Nikki Yost, who is probably at the front desk. And then we also have Katie Jameson, who is a patient and works for us part-time to help us plan things. I wouldn't be here today, and many of us wouldn't be here today if it weren't for Mary Hasdorfer. And I know that she's watching. Hi, Mary. But she wanted me to give her best to all of you and how grateful she was for the opportunity to be part of this foundation for so many years. And she is loving retirement. So, again, thank you so much to all of the board members who are here with us and our incredible crew of volunteers and vendors who have stepped up to help us. Our AV crew is Uno Deuce Media. They're based out of Michigan and owned and operated by one of my best friends. Paul, you want to wave your hand? He's the guy who makes the magic happen along with his team. I do want to also make sure that we thank Dr. Pikert, who came in. He will be leading the scientific meeting with us, he and Dr. Zotterer. We have events like this don't happen out of thin air, and we do need resources to make that happen. And we are here today and having a really neat event because of our sponsors, the fine folks from MRHFM, Bristol Myers Squibb, Novacure, Merck, the Gorey Law Firm, TCR Squared, AstraZeneca, the Early Firm, and Vogel Zhang Law. At the breaks, we invite you to go out and check out their tables. Many of the folks from our wonderful partners are here, and they'd love to talk to you about what they do and how they're part of the meso community. So you all know this was a challenging conference to put on, from QR codes to crazy weather to masks and testing and vaccines. And so we made this a hybrid event to keep everyone safe. So we appreciate that you all have taken the steps that we ask you to do upon the advice of our medical community. That means that unless you are actively eating or drinking, we ask you to wear your mask. Those people who are at the podium and at a distance will be unmasked in order to make sure that our folks at home are able to understand everything that we're saying. But we do ask that you do that in order to keep everyone safe. Folks in the mesothelioma community are medically fragile, and so this is to just keep everyone safe. We care about you, and we want to keep you here as long as possible. We made some compromises as well. We kind of thought, oh, we were going to get a couple hundred people in person, but instead we flipped it on its ear. Obviously, you guys can see who's here in person. This is a great size of a room. This room normally accommodates twice as many people, so we made some choices. We also have well over 100 people who are watching live right now via our website. And all of the sessions here in our community conference will be recorded and available on our website within the month. The scientific meeting will be taking place here at the same time, so the leading experts in mesothelioma will be down the hall. They are going to be discussing frontline therapy, second-line therapy, third-line therapy, clinical trials. They will be talking about prioritizing research into mesothelioma and creating centers of excellence for mesothelioma treatment. They have a robust agenda, and then they will come back and report out at the end on where we're going. We've positioned it as the Great Debates, and we know that that will hopefully advance the science and find more better treatments and cures. I also want to say that our bereaved community will be meeting separately, and I want to take a moment. Maria and Anna, where are you guys? Where did they go? Oh, they're out in the hallway. Maria and Anna are leading our bereaved sessions, and they will escort you out at the end of this session because this is the room for our community. This is the big room. This will be Mesothelioma 101 and a variety of wonderful sessions that you can see in your program. But our bereaved community is meeting separately, and scientific meeting will be meeting separately. And now time for some housekeeping announcements. This is the fun part. Now, I mentioned the QR codes. Did everyone get a QR code to get in the building? If you want to eat outside for lunch or go outside, you need your QR code. Turn your brightness up full blast. It's the only way to get through that. But be sure to have that QR code. It's the only way to get in and out of the building. Our staff will be available to make sure that you can get in and out just in case. I also, in this room, we will be doing Mesothelioma 101 featuring Shannon Sinclair from the foundation, but I'll introduce Shannon in just a moment. The most important thing is the restrooms. When you came off the elevator, ladies' room is to the right, gentlemen's is to the left. So that's where the bathrooms are. And I think everyone found the food, but in the event that you are feeling hungry, there is basically continuous food and snacks. Breakfast is out there right now. Coffee and tea and other drinks will be available the entire duration of the conference. At lunch, we invite you to grab your lunch. You're welcome to come back in here. You're welcome to go outside. You're welcome to sit out there in that cafeteria area. So we want people to spread out in order to promote good practices and safety. We want you to do that. Finally, again, with the masks, the only time we ask that you remove your mask is if you're actively eating, drinking, or if you are a person who is speaking at a conference, at the conference. That's pretty important to all of us. So I know it's frustrating. I know it's hard. We all get hot and sweaty, and, it kind of ruins our makeup, which is, that's an issue for me. But we want to make sure that we keep everyone safe. So at this point, I want to invite everyone to, for those folks who are staying in this room, stay put. For all of you who have an MD or PhD or RN after your name, or me, we are going to go down the hallway and we're going to go to the scientific meeting. So I'd like to excuse our illustrious doctors to head over into the scientific meeting. Unless you want to stay here into the community conference, it's entirely your choice. For those of you who identify as members of our bereaved community, I'm going to invite you to head on out with it's actually right there. I can almost see the door. But our bereaved sessions will be starting there. They're also having a celebration of life. And then everyone else here, I'm going to introduce our speaker in just a moment. Does anyone have any questions? All right. Let's have a great conference, friends. We'll be back together in this room at noon for awards, and then we'll come back together at the end of the day. So thank you for being here, and have a great day.